Mike Bennett and Vinny Gupta, and we've got Peter sitting in. We're going to talk about the living city and resilience and what happens when things go a bit more wrong than they ordinarily do. All right, so just to say the city of rainforest, this idea of biodiversity in the city, that each building is in a way like a plant or in a way an animal wandering around in a very complex environment, inputs and outputs, and interacting in a way that nobody's really got a handle on. And when it's all working, it's kind of fine, but I'm sure that, well, in terms of the work that Peter's done, the looking at the city and trying to get it to work in a way which makes sense. We haven't got there yet. So, to say really, it's quite a difficult thing to think about, particularly when things start to go wrong, because you're dealing with a level of complexity that just has unpredictable outcomes. You kind of reduce something a bit, and then all of a sudden you get a change in state. It's kind of chaos theory. So, what I thought we'd do is look at, in terms of resilience, there are certain things that cities over the years have become resilient to. And a good example of that is fires. Because in the early days, cities used to regularly burn down. Chicago burnt down with sort of hundreds killed, 4 square miles devastated. London, obviously we've been going longer, but before the Great Fire of London, it burnt down 4 times previously. So that we didn't quite learn from our mistakes in the way that we thought we would. But in fact in London we had very few casualties. There was only, they think there were 7 casualties in the Great Fire of London, mainly because people didn't stay to fight the fire, they just kind of ran away, which turned out to be a sort of good strategy for people, but it meant the fire burned for 4 days and hardly anybody fought it. It kind of burnt itself out. They dynamited some of the streets to stop it jumping. But obviously that's not a very practical day-to-day way of dealing with things. The other example we've got is Tokyo, which 1923 there was an earthquake, but that was followed by a fire, because what happened was that all the buildings shook, and then it happened to be at lunchtime, everybody was cooking their lunch, so that when the buildings fell down, it started fires everywhere. So you can see that these kind of things, for a city, we've kind of demonstrated that there's a reason to move beyond all that. But actually it's quite a complex response to deal with that, because things have to change at different levels. So first of all, you have to have changed behaviour. People running away, you've got to do something about that. They need to somehow alert the whole system so that there is a fire, and have to try and put it out if it's not very big. Because apparently the Great Fire of London was a very small fire to start off with, and nobody put it out, and it just spread. Building better is obviously stone buildings, but interesting that in London they had in something like the 12th century they had a building code which said stone buildings, not wood, which is very sensible. But wood was far cheaper, and there was no penalty for putting up wood instead of stone, so it didn't work. And then in the Great Fire they just happened to have a wooden scaffold around St Paul's, which was a stone building, so it burnt down anyway. The whole idea of public fire brigades.
Mike, can you move that microphone a little closer to you?
Yeah.
It's that one.
Oh yeah.
Yeah. That one? Yeah. Thank you. Yeah.
Okay. Okay.
Yeah. Thank you. Yeah. We hearing everything you're saying. It's just been a little more difficult.
Yeah.
That's all.
Yeah,
okay.
Fire brigades. The first public fire brigade was in fact in Rome. The Romans were organised about these things, but then they fell out of use for the next 2,000 years, or almost 2,000 years. You probably know in the UK they had this system where you could insure your building, put a little mark on the wall, and if it burnt down, fire brigades would come along, and if the mark indicated it was your fire brigade, they would put it out, which kind of worked for the individual insurer, but the whole city could easily burn down just the same. So, and finally, the building codes, you had to have building codes which were enforced. And so, if you take London, you had to have enough, the building code and the fire brigade and all the rest of it. And then you would have a city which is resilient against fire. So it's very rare now for a major fire to get hold. And there was one recently in Soho, big fire, but only the building itself burned down. So those things are kind of working. So it's just to say that it's the individual, the group, the organisation, the state. All of those have to work together to give you a resilient result. But now everybody knows that fire's a problem. They all, and Arup has a big section that deals with all the things to do with fire in a building, and it's just something that we've dealt with. And if you go back to the rainforest thing, rainforests deal with that. They actually burn down, but some of the seeds are designed to only grow after fire and things like that. So the rainforest is resilient. So I'm going to hand over to Vinay to talk about the risks.
So, we want to talk very briefly about classes of risk. So, fire is an old risk. It's a risk that we took hundreds of years to become resilient to, and now we don't think of fire as being a systems level risk. It's become a point risk. Climate is a new risk, and it's enormously systemic. It's systemic on a scale beyond anything we've seen before. Earthquakes, point risk, but we have a whole new class of buildings which are much more vulnerable. We also have enormous numbers of people living in very poor quality construction, not in the US, but in the developing world. These kind of cinder block death traps. Pandemic, it's a systemic risk, but it's become adapted to the modern transport environment. So you're in a situation where you don't get a few travellers coming in at port sick. You wind up with people travelling all over the world on aircraft, and the risk gets everywhere immediately. So this question of new risks and old risks and point risks and systemic risks gives us kind of a 2x2 matrix for thinking about risk. And the most dangerous risks are new systemic risks, because we've got an enormously interwoven society, and they're risks that we have very little experience dealing with. So the fundamental risk is that somebody will die. More or less anything other than physical death is an inconvenience, because in the long run we can rebuild buildings, we can rebuild cities, we can restore civil services. It's the risks that kill people before we can respond that are big issues. And one of the models that we use is a thing called 6 Ways to Die, which is part of a package of content called Simple Critical Infrastructure Maps, or SCIM. 6 Ways to Die being heat, cold, hunger, thirst, illness, and injury. That's an individual level. To the city level, it's not likely in most situations that sudden death will be the problem for a city. What kills cities fundamentally is economic risk. They can become so badly damaged because of a crisis that they're just not worth rebuilding. And a good example of this was Memphis in, I want to say, the 1820s. There was the New Madrid earthquake, which decimated Tennessee. They had 30-foot wide cracks that went down hundreds of feet in the ground, and enormously severe tremors. And what happened was the population simply left Tennessee. Part of the reason that Tennessee is still underdeveloped relative to surrounding states is because it took something like 30 to 50 years for people to return to the area in large numbers and to begin to do infrastructure investment. And you can still see that impact 100 years later. So this is just very briefly the 6 Ways to Die model. Can you see that at that end, Quirrell?
Yeah, we can. Yeah.
Okay. So you have the 6 Ways to Die on the outside, and then you can see the infrastructure systems that we've built around us minimize that risk. Right? You can see, for example, home is a household level system that's connected to a regional system, which is the power grid, and that provides you with heating and cooling services. If you look at cooking, you can see that we have the supply chain that goes out from household level food storage through to urban food storage out to the global food markets. You kind of see how that works? So this is a sort of an objective way of looking at infrastructure, in that it refers to two things which are real. The first being, these are the biological modes of human mortality, and on the other axis, what you have is the bureaucratic levels of organisation. You can actually draw one of these diagrams for a real city, and you can put on individual power stations, and you can put on individual utility companies, and you can put on individual hospitals and police forces. So you've got an accurate map of the support network which keeps individuals safe. Does that make sense?
Yes. Now, radially, as you go to the outside, it is like a geographic map, isn't it? So, in other words, you're getting more and more remote, or you're getting to a wider and wider area of coverage as you move towards the outside of your diagram.
To be very specific, we're operating not in geography, but in bureaucracy. So we're dealing with different tiers of the bureaucracy, because in a crisis, it doesn't really matter where the power station is, it matters who you phone.
Yeah.
And that was actually a key distinction. Previous efforts through infrastructure mapping had worked in geographical space, and it turns out not to give you the information you want. What you really need to know is who to call, because the system complexity is enormous. This is that approach. If you're looking at disaster relief in the developing world, what you're trying to do is localize everything to the household or the village level, because you can't guarantee continuity of services from the stuff further out.
What we can't read very well are those labels for the concentric circles here. So could you read those out, starting with the individual?
Okay, so it goes from individual to home, village, town, region, country, and world.
Oh, okay. All right.
Yeah.
Good.
But those are somewhat arbitrary, because when you're building one of these maps for a specific area, like in the US, you're going to go something like county, state, federal, and then kind of international bodies, and then within that you might have regional stuff like, say, TVA or something like that. Anyway, it's a useful background map, and drawing them for specific situations gives you a way of having multiple teams who are part of that infrastructure network communicate with each other about resilience, because you can actually draw the connection, for example, between the water plant and the power plant. Although it's not on this version of the diagram, it gives you a context that everybody can agree is objective. So,
and what are the radial lattices on that picture? The concentric circles. You have labels on those along each radial.
Okay, so those are too hot, too cold, hunger, thirst, illness, and injury.
Okay.
6 ways to die.
6 ways to die. So you can say that, for example, if you look, can you read the labels on food, for example? That's the hunger section, which is at the bottom.
Yeah.
So you can see that, for example, kitchen storage is household level food store. And then you go out 2 rings, and that's food stores, as in food shopping, and that's at the town level. And then you go out all the way to the edge of the map, and you can see food markets and fuel markets, and that's your international food logistics network. And it's just this way of tying together local and global systems. We found it very useful for getting people to cooperate in discussions about infrastructure, because it's very hard for people to think about it because it's invisible. It's one of these invisible, we call it the invisible grids. So let's move on to the scenarios. The first scenario we wanted to look at was a pandemic, because obviously America has declared a state of emergency on this stuff. National emergency?
Yeah.
Do you remember exactly the phrase?
Pretty much,
national emergency, I think it is. So, right now...
There's a lot of information flying around, and a lot of communication about what to do, what not to do, how to respond, lots of vaccination programs, and
absolutely. It's chaos.
Seems to be relatively well communicated.
Well,
hand purification solution dispensed in our lobby of this building.
Yeah.
Good. So right now, H1N1 just isn't killing anybody. Right? I mean, it's the fractional risk of dying from it is substantially lower than getting hit by asteroids. The last time I checked. There's no guarantee it will stay that way. In 1916, Mike did some research on this. 1916 was when what we call the 1918 Spanish flu, actually it started in 1916. There was 2 full years of Spanish flu activity before it mutated into a virus which killed about 1 person in every 20 that got infected. So we're not actually out of the woods on H1N1 2009. We might have several years before either everybody's caught it and become immune, or the damn thing mutates and really begins to do some damage. Because if you think of all those people who are getting sick, imagine the level of panic and stress if 1 in 20 or 1 in 50 of them died. When this thing came through in 1918, it killed 1% of the human race. And we have no guarantee that that won't happen again. And it's by no means a worst case scenario. H5N1 is currently 70% fatal, and it spreads in exactly the same way as an ordinary flu. I did some work on that with US DoD, and the paper is called Severe Pandemic Flu Strategies, and it starts with the assumption that you're going to lose a quarter of the human race in the next year, and your job is to stop it becoming half. And that stuff is entirely realistic. Like smallpox killed a third of the population of Iceland in 1750 in a year. Just bang. So this stuff is to some degree not if but when. Right? It may be 2%, it may be 5%, it may be 0.5%. The question is, what do we do about it? Because right now we have very, very little resilience to this kind of threat, particularly when you start putting quarantine into the equation. So I'll make a brief aside here, which is not actually part of this presentation, but is significant to ARA. There's a bunch of work done by Police's team at Mount Sinai about altering the air conditioning factors. We talked about this when you were in London. Altering the air conditioning systems in buildings so that you don't get flu transmission inside of the building. You can cut flu transmission to very close to zero by maintaining 70 Fahrenheit temperature and 70% of humidity, because the little droplets with flu viruses in them that would normally fly through the air absorb so much moisture from the air they just fall to the ground and become inert. And there's an enormous opportunity here to flu-harden buildings, particularly things like airports and transport infrastructure, in a way that's actually more effective than people wearing masks. So there's a ton of work to be done there. Anyway, let's move on. If you wound up with some kind of infectious agent crisis, there are all kinds of problems that you might see, but one of the hardest ones is moving supplies, because if you have a quarantined environment, running a supply chain in a quarantined environment is extremely difficult. Food is a kilogram per person per day, more or less. So if you take New York, say rough population 10 million, you have to move 10,000 tons of food a day, which is an extremely substantial number. And that kind of supply chain management isn't just an infrastructure, isn't just a shipping problem, that's an infrastructure problem. The idea of building a quarantine supply chain to move 10,000 tons of food a day into New York, you begin to think about this process of, well, where do you put the food in transit? How do you sterilize the food as it's moved from place to place? How do you distribute it in such a way that the virus can't hitch a ride along with it? Just how do you do this bulk supply chain? Can you do the bulk supply chain? Another question, insulin. Something like 1/3 of a percent of the population are insulin dependent. Most of them will get sick very quickly if they don't have it. Insulin, fortunately, stores relatively well. You can keep it at room temperature for about a month, and it'll store refrigerated for very long time periods. But the question is, how do you identify who needs it in a crisis, and how do you get it to them if you've got all kinds of other problems? And there are actually, when you go through the list, an enormous number of subtle drug dependencies that people have. It's insulin, it's interferon, it's protease inhibitors. There's a whole range of things which, if you don't get them, you're going to get very sick. And there's such a profusion of different things that it's very hard to imagine building a bureaucracy that can harden all of those supply chains. So this is something where, because it's so many different things, where do you put the responsibility for doing that? Do you leave it at this high level where you're talking about a government level intervention? Do you push it down to the individual? Do you deal with it somewhere in between, like at hospitals? Just where is the correct place to build supply chain resilience? And it's probably different for food and for insulin. So this notion that something like a flu doesn't just hit the individual, but it also hits the social infrastructure like the supply chain, raises the hard question, which is, how do you try and mitigate the social impact of something like a pandemic because of these complex system effects? You're dealing with a system which has enormous inherent complexity. You pressure the individual level, but it's the social level that breaks. If everybody stays home from work because their kids are sick, and the lights go out, suddenly you have a much bigger problem than a bunch of people who didn't go to work. You have system level effects. And attempting to cushion those interdependencies may mean redesigning the way that we do infrastructure to give us more resilience to this kind of problem. Does that make sense? What does it take to get critical infrastructure into a position where you reduce its exposure to complex systems risks? So, the four approaches to mitigating risks that are in common use are stockpiles and backups, which is, for example, a personal supply of insulin or backup generators, and planning to do without. This is actually a substantially underused response option, but if you plan that you're just going to not heat your buildings in a crisis, then you may be able to actually get by with much less backup power generation, for example. If your standard plan is if we lose power in the building, we're going to run the computers, but we're not going to run heating, and everybody knows that, you can simply prepare for that contingency. Everybody knows that in a power crack, you're going to come to work anyway, but you're going to wear 3 pairs of gloves. Training is another avenue where you basically improve the quality of response to the problem. You redesign the way that people are going to behave in the crisis to give you more resilience. Changing the way that medical staff do triage for flu cases, for example. And then finally you get to the systemic level changes, where you actually change the way that systems operate by, for example, taking a ward which would overload with flu victims and starting to investigate things like home treatment. What happens if we alter the way that we handle pandemic flu by suggesting that home treatment is the primary response, and you're only going to take people into hospital if they have to be on a ventilator? What happens if you start thinking about designing ventilators that can be operated at home? So figuring out how to apply those 4 interventions across this level, all these levels of complexity, is a sort of core challenge in terms of systems interventions. Does it make sense?
Mm.
And what we're trying to do here is build a simple conceptual framework that can be used as an analytical model to take apart complex contingencies into manageable pieces, to actually generate a to-do list that will work from the arbitrary complexity of an open contingency. So this question of locating the risk at the right level of the society is really a critical pivot. Like right now, we've got a whole bunch of federal agencies that handle different classes of risks, and we've got local responders. But there are all kinds of risks that slip through the cracks. Like, everybody knows that citizens don't prepare. The ready.gov recommendation is something like 30 days of food storage and 3 months of prescription drugs. And I don't think I've ever met anybody who did that. Even professionals working in the field don't do it. Human psychology seems to form more or less an absolute barrier to that kind of preparation. So, beginning to think about locating the risk management strategy at the right level of the social system and being realistic about what can handle the load is a key part of this stuff in the long run. So this is what I mean by cross-level response. You want to try and figure out where in the system you've got the leverage to move on the problem using these kind of 4 actions. Where can you train, where can you prepare, where can you do without, how you lock those pieces together to get movement. And the more of this we can handle at the individual level, the better, because a lot of times what you get is failover and promotion. So the individuals are unable to handle the crisis that they're in, so you then require regional response or state response, and if the state level is unable to handle, you wind up going to the national level. The further down the response tree you can handle the problem, the less of the load you're going to put on the state level responders and the regional level responders. So this gets us to scenario 2, Cold Katrina. Cold Katrina basically envisaged is a terrorist attack on one of the grids. So it could be natural gas, it could be telecommunications, or the most likely target is the electrical grid. The electrical grid has been fragile for at least 30 years. Brittle Power was originally published as a DoD-funded study in 1982, I think, and it was reissued in 2001. And fundamentally, the grid has not gotten a lot more resilient since then. Last time I checked the numbers, the Western grid was running within about 0.5% of maximum capacity all the time, and a lot of the infrastructure was 20 or 30 years old. And deferred maintenance is how grids die. There's also a lot of extremely disturbing sociology on, particularly Muslim terrorist networks, indicating that they're made about 25% or thereabouts of professional engineers. And this should really worry us. Nobody really knows why this is the case, but there's an extremely good paper on the subject, and it's diabolically scary reading. These guys have significant engineering capability. So the assumption is that if you put these two things together and shake, you could wind up with the death of the US electrical grid in the middle of winter for a sustained period. And if you add to that an incompetent federal response, you have the scenario we call Cold Katrina. Now, would anybody like to estimate the possible death toll for something like this?
You obviously have, so just
Well, you've got New York, you've got Boston, you've got Rhode Island, you've got Detroit, Cleveland, Chicago, Minneapolis.
How long for? What period?
Well, let's say 3 months.
3 months.
Yeah.
God.
Well, I mean, those 44 kilovolt lines, the ones that actually do the backhaul in the power grid, those things are real fragile. They're hard to
If it was that long, it would be 1 million at least.
Well, or you'd have to evacuate the whole population
Because
south.
it would be everyone over about 70, probably, or 75.
It's just diabolical, isn't it? Right? So what we're talking about is really, really serious war-level casualties from a scenario that could be executed by something as small as a couple of guys in a van full of high explosives. This is really, really substantial risk, and it's a very scary scenario. So to get to the kind of resilience that would be required to handle something like a winter grid failure, we're going to have to really change the way we do things. Right? We need to change the models of what cities are expected to be in a really profound way, working towards unmaking the risk. Right? Currently, the effort is largely towards hardening the grid so that the grid will not go down. But I don't think anybody really believes you can harden the grid to the point where it won't fall over. It may be possible to do that, but I don't think anybody in the industry believes that is where we're going. So there are also strong reasons to think that, particularly with all the computer components, it may be simply impossible to harden the grid to the point where you know it won't go down, because you also wind up with monoculture risk. If the attack was, for example, cyber terror, you could wind up in a situation where faults in common operating systems were the critical vulnerability, and that stuff is much harder to harden than just building additional power lines. It's very hard to know whether you've got that stuff right until you get punched. So what we need to think about is a completely different model of where we're going. Can you guys read the labels on this slide?
we can, yes.
Okay. So normally the way that this kind of stuff gets handled is you wind up with a crisis, something horrible happens, and you adapt. You go through this transformational response and you just do things differently. Earthquake building codes. What we're hoping to do here is skip the process of going through the crisis, because the crisis is so bad you can't take the hit. Right? We might get lucky and we might have a 3-day power outage over the whole US that just scared people straight, and then we would do something. But the first time we know there's a problem, it might be something that really seriously causes issues, like having to evacuate the whole north of the country. Right? So this process of how you go from the normal to the unthinkable, we call visionary adaptation. And we don't know how to do this. Right? We just don't know how to do this. But the choice is between getting slugged and then adapting, and building a practice inside of large organizations which allows us to do really hard things without having to get punched. And we have some thoughts about how that might get done. The core of this is the psychology of risk. We're very poorly evolved for handling risks with enormous impact and very low probability. There's a bunch of psych on this, but fundamentally, we just evolved in a situation where the worst thing that could happen was a tribal level catastrophe. And now we're dealing with tens of millions of lives. We just don't have the math for astronomically small risks and vast impacts. Risk estimation is also a huge factor. People act on the perceived level of risk rather than the actual level of risk. And changing the perceived level of risk is one way of changing behaviour. Accident black spots, where you've got a bad curve, where you keep getting car crashes. If you straighten the curve, often what happens is the accident rate is unchanged or even goes up. But if you plant lots of trees to reduce visibility on the curve, accident rates go down. Because what you're doing is you're making the risk visible to people, and as a result they change their driving behaviour. Completely counterintuitive, but there's good science behind this. They really do this, it really works. It's a civil engineering practice. So when we start thinking about how do we make these risks visible in a way of compelling people to act, you begin to talk about changing the way that we do risk communication, changing the way that engineers communicate risk. Finally, we're very badly wired for handling cascade failure, because again, nothing in nature goes through cascade failure at a human level. We just didn't evolve in a situation where you kicked something and the lights went out for 500,000 people. So what we have is a systematic bias to underreact towards large-scale complex contingencies. And if we look at this as a psychological problem that organizations then pick up on, what we can do is push very firmly on the risk communication, on the complex contingencies, and get people to consciously unbias their thinking about these large-scale risks, and then allocate the necessary budget to basically give us the insurance we need against this. Mike?
So I think what we're looking at here is you've got these complex systems, and we just have to understand the way this works and go through it and kind of change everything in the way we beat fire. You know, if we want to beat swine flu, not just this time, but for any future virus, then the various things that would have to not necessarily change every day, but be available. So if you had this particular kind of air conditioning, then that would be a standard facility in buildings which could be switched on. And it's an educational thing, so people know what to do in that kind of situation. And we do proper research into masks and that kind of stuff. A lot of the risks that we have in our society are around buildings and cars, and there's a certain resilience around that. But then, you know, I think what we're talking about here is moving as we develop really as a species. We're moving into arenas where we're resilient to more and different kinds of risk. So, you know, in the Middle Ages, terrorism wasn't an issue. Swine flu certainly was, or you know, their equivalent things, but they basically just died of it. You know, it's like kind of Monty Python, bring out your dead kind of. That was how life was. So it's a question of how you move forward from that situation into things which are not normally perceived as risks for this year. So, you know, viral attack, there could be one every 30 years or something like that. But if we're not, you know, what that means is it could happen any year. It doesn't mean it's going to happen in 30 years' time. So if you're not always ready, it's going to have its effect. So if we hadn't fixed fire, you know, you can just see that a lot of the way that we live life just wouldn't work properly. But as we get more sophisticated as a species, we need to deal better with these kind of things. The whole international travel thing, it means that something like swine flu is like we've given it a transmission methodology we just never had before. And so unless we deal with that, you know, we've increased the risk without doing anything about it. And you know, so this is the difficult area of people understanding this, because the thing about fire is everybody understands it's a risk, but swine flu, people kind of don't really get a sense that, you know, in 1918 it killed more people than World War I. Well, you look at all the books about World War I, look at, you know, it's hardly anything about swine flu. The government has just announced a magnificent sum of £7 million to do some basic research into swine flu. You know, it's kind of it's the wrong level of response to the problem. So,
sorry, you had a bullet point there on your previous slide. Policy backs tech. What do you mean by that?
Well, a lot of this, you know, engineers can produce the tech. You know, if you say we want to understand how to deal with swine flu, then you just need a bunch of Arab-style engineers to go through it's an engineering kind of problem in the end. It's also medical as well. But the policy has got to back that. You know, you can't do that in isolation. So unless
so the policy needs to back the technical response.
That's right.
Yeah.
That's right. And that's often where you know we can do it, but are we doing it? It's a kind of thing.
Yeah, sure. No, I get that.
Yeah. So as I say, it turns out to be the people for this, and started off being an engineer. I'm kind of biased, but it's interesting talking to lots of people about these kind of things. If you talk to people who are in think tanks and sort of about policy and things like that, they kind of don't get it. You know, they'd like you to write a nice report about it, but the idea that action ends up at, you know, the result of some work is action, is an engineering focus. And of course, it's engineers who produce the buildings and the cars, and in many ways have produced the city, but by looking at particular systems within that. You know, so there's a grid system, a water system, maybe a gas system, but they're not that integrated often. So it also asks for a bigger view from engineers about what a resilient city is. And, you know, some of the work Peter's done, it's like bringing a lot of those systems together. And I think you know, what we're talking about in a way is also some disaster proofing. So it's things that are not always going on, but that you know, something nasty comes along and the whole thing just doesn't fold. You know, like in London, they think they've got about 2 days' food in the pipeline. Well, that's not very much if you suddenly have problems with food. You know, so how do you have a system which is engineered to have that kind of resilience built in? So we thought, you know, what sort of things come out of this in terms of how to take it further. And I think that the first thing is a lot of the kind of things we talked about. They're the kind of things which, you know, if you take swine flu, you sort of feel it's been thought about because, you know, we get all these people on television telling us what to do, often contradicting each other. But you know, there's sort of something going on. But what you see is that actually they're mainly dealing with the individual. So they're saying what the individual should do if they've got flu, but they're not dealing with what happens if there's a higher death rate than the very low one we've currently got. They're not dealing with what would the effect of that be on infrastructure. You know, if everybody in a particular nuclear power station suddenly gets swine flu,
right.
Can you keep the power station going? You know, it's that kind of thing. So I think an interesting thing.
Give me 1 second.
Yeah.
Keep on.
Okay,
Sorry.
Okay.
Keep on talking.
So an interesting thing to do is to look at some of these systems and go into them fully and see, well, what does that mean? Because often, the impression is, well, there's an awful lot you ought to do to make it really work. But is that true? You know, is there a kind of a low level of stuff that you could do to prepare, and then you've got another chunk of stuff that you, when it actually happens, you bring it in.
Put in place.
Yeah. But I think often the issue is, you know, these prospects which can be scary. Well, it's difficult to think about them, and it's not very clear whose job it is to think about them. But we've talked, for example, to people in the Cabinet Office in London, whose job it is to think about these things. And to be honest, they aren't really thinking about it. You know, the kind of replies you get, it's kind of scary. So that even at very senior government level, they're not taking this kind of stuff on. And you know, when these things happen, they have very serious consequences. So the idea of a kind of Resilience Now plan, which is like you take a particular organisation and you say, in the next year, we're going to resilience proof it against the scarier options. So, for example, if you have the sort of power grid kind of problems, well, what does it take for a company to keep running in a situation where it has major power grid problems? So that that might involve working from home. But then, how do you ensure there's power supply there? How do you ensure your network stays up? How do you ensure that you've got, if the mobile phone network goes down, or all those kind of questions, which you can look at for an individual company, where you say, well, if we've done all this, actually, there's all these things that could happen, but they won't. They won't affect us. We can keep going. And in a competitive situation, when things go wrong, then it's the companies that keep going that can get the business to put it right again. And this is, I think, particularly true in engineering, where often it's the kind of expertise that people need. And the other possibility, really, which sort of is the idea of a pilot project to look at this for something like Arab, where you've got the kind of the technical understanding of a lot of this stuff, which other companies don't have, but also doing it internally in some way means that can get you into the position where you can sell some sort of resilience plan or project or technology around networks, or sort of an engineering solution to